Hello, my name is Cedric Herraj. I'm a GP here at Hernhill Group Practice. We have employed Mohammed Mia here as a practice-based pharmacist since April of last year. We have a multidisciplinary team that consists of doctors, nurses, healthcare assistants and nurse practitioners. We have a considerable number of nurse prescribers as well. Having Mohammed adds a particular perspective around managing medicines, and he's here on site so can answer complex queries about combination of medicines, new treatments, suggested treatments and difficulties with administration. Having a trained pharmacist on the team means that we can liaise more effectively with our community pharmacy colleagues. Mohammed has been to meet them all and we've talked about issues around dispensing, obtaining prescriptions. We've ironed out some issues around the electronic prescribing, the difficulties the community pharmacists have had in receiving our prescriptions. He can sort out medicines reconciliation following discharge from hospital. He can link us with the hospital pharmacy team and the CCG. There are some other issues around time pressures. We have a considerable number of repeat prescriptions on a daily basis, and Mohammed has been quite helpful in looking through some of those, making sure that the medicine combination is still rational and reasonable, and also ensuring that we're doing any monitoring or testing that's required for patients. As a person that understands medicines and the systems and processes around managing medicines, he's completely revamped our repeat prescribing systems so that the reception staff who manage the administrative part of the process are much more clued up on what's expected of them. Mohammed can have longer appointments and we can be selective about the patients he sees. Elderly patients that have complex polypharmacy regimes, Mohammed has worked with us to look at the possibility of simplifying some of those regimes, looking at the benefits and disadvantages of certain drugs and actually producing simpler medication regimes that are easier for the patients to tolerate. One of the key issues about having a long-term condition is you have to take medication on a long-term basis. Mohammed is very good at working out patients' expectations around medication, discussing it with them and ensuring that we can have the best possible adherence to those complex treatment regimes. We have about 100 patients who receive their medication through a compliance aid, usually a dosette box. Mohammed and I have been working our way through these patients to make sure that the treatment is still appropriate, that the appropriate clinical reviews have been undertaken, and this has been very, very helpful indeed. We've had a couple of patients, I think one of them was interviewed, where Mohammed's intervention has actually supported him in improving his diabetic care, being more compliant with treatment and having better biochemical measures of his diabetes, reduced HbA1c, better controlled blood pressure. We have other patients who have had difficulty in complying with their blood pressure regimes, and Mohammed has worked with them to produce simplified treatment regimes and also to help them understand the importance of adherence and compliance. Understanding the purpose of medication, understanding what it does, how it works and what it's for, and particularly the importance of taking it in the scheduled manner, is something that Mohammed can reinforce with quite a lot of patients.
Hi, my name is Mohammed Mia. I'm the practice pharmacist at the Hernhill Group Practice and a pharmacist independent prescriber as well. On a day-to-day basis, I'll have pre-bookable appointments during which I'll see 10 patients. I also see walk-in patients that can be for minor ailments, for medication reviews, for any kind of medication queries or just general GP referrals. As a pharmacist prescriber here, my role is to look at polypharmacy and adherence, and in particular with patients with long-term conditions and who are on polypharmacy, to actually review their medications to minimise possible risk caused by medications, but also optimize their medications so that they're getting the best therapeutic outcome from it. I also deal with queries sent by clinicians, which would normally take up clinician time specifically to medications. That can be around several different things. That could be around best prescribing or best management of a therapeutic area, management in respect to guidelines, For example, one of my roles is about reviewing patients on a regular basis, especially with long-term conditions, and adjusting and reviewing their medications so that we continue to improve their care in line with what the national and local guidelines are and what evidence-based practice there is. In terms of long-term condition management, my scope of practice includes cardiovascular disease management, including hypertension management and hyperlipidemia. I've also extended into diabetes and respiratory disease. Another part of my day will be dealing directly with queries, medicines information types queries, management plans, starting a new drug, starting a new medication that may or may not be within formulary, that may be new, and whether it has shared care agreement in place. If it doesn't, establishing it, best prescribing or best management of a therapeutic area, management in respect to guidelines. So that will feed into how we manage our repeat prescribing service. So if patients come in and they're overdue a review, or they want to discuss changing medications, patients will come in and discuss that with me. Also, a key part to my role is increasing the established relationships that we have with external stakeholders such as community pharmacies, pharmacists in secondary care, and specialist clinicians from secondary care to make sure that medication is up to date. I'm in a position where I can also undertake audits on the practice that we do, both short-term and long-term, to improve our services and the care that we provide. One of the examples is how we process our discharge summaries, ensuring that the coding is correct, ensuring that the medicines are reconciled, they are appropriately written in the consultation notes, and the information is liaised to the relevant healthcare providers within the surgery and to the patients and to the pharmacies. There's often a lot of complaints about the workload and the paperwork that's involved, but I believe within my role as a practice pharmacist, I facilitate that by ensuring that medicines are reconciled appropriately, that clinical coding is undertaken, and that relevant staff are trained on it, ensuring that pharmacists work with both the clinical and non-clinical team to train them appropriately, whether it's in terms of medical coding, clinical codes, or even in terms of processes such as the repeat prescribing service and how we improve it. A massive impact that I do have is the follow-ups that I have with patients, and it reduces the workload on GPs and other clinicians where I can actually review patients, review their management, change medications according to their response, according to the therapeutic targets and the plan that we have in place. I feel that I've formed a missing link that wasn't actually there previously between clinicians within the practice, but also between external care providers such as community pharmacists. And locally it's had a very positive impact. Patients have fed back well, and our relationship with external healthcare providers has actually improved. Part of the service where previously as community pharmacists you may be unable to undertake a MUR, for example, at home. As a practice pharmacist, I can actually go in and see patients and actually see what it is that they're taking, what they're using, how they take it, what concerns they have, and how we can improve that. So I think that's a vital part of my role as well.
The greatest thing about Mohammed is that he's incredibly patient. He listens to what you say, and he seems to have all the time in the world. And it's just really nice to have someone who's got background knowledge of things like that and can talk to you. He has been, for me, an absolute lifesaver. It's made just a huge difference to have someone who talks to you and listens to what you're saying, and then, gives you such really good advice and is there if you need them on the end of a phone. It was interesting because with Mohammed, what I was doing was what I'd sort of been told to do at the hospital and was merrily doing, but he said, no, you must do this, this and this. This is the correct way to do it. And that's made another enormous difference as well. I was just saying, you put this on, then you put this on, then you put this on. But he said, no, you've got to wait a quarter of an hour before you do this, and then so before you do that. And it's just made a huge difference. To how the feet reacted to the problem and the treatment being used properly. A huge bonus is that he'll come and check that, everything's going okay, and you actually feel there's someone out there who actually cares. It's tricky. I've seen one of the nurses came down once and she was very nice, but there again, she was pressed for time. She had another appointment to go to. I mean, it's not their fault. It's the pressure of work and everything, I suppose. It's a question of having time to explain why you're doing it this way and what the benefits will be.
I've been seeing Mohammed more than my doctor. I see him because I feel so confident with the man. And yeah, it makes me feel good, like, talking to someone who will listen to you and explain, as I say, the way he goes into detail with things, and so no questions at all with him, Well, I find it's very helpful, and I feel very confident when I talk to him about the medications, because the way he explains about the medication, I've got no worry about it, really, because for me, I've got the best of both worlds. I've got my doctor and the pharmacist. I have no problem at all on sorting out which my medications are, what they're for. I find it's quite helpful, I mean, you sit there and he will listen and he'll answer all my questions, and by the time we're finished, I'm quite conversant with the medication that I've been prescribed. I do feel very confident.
Seeing him allow me to take my medication seriously. Not knowing the medication that you're taking, not knowing it, or not knowing about it, sometimes you're inclined not to want to believe, or not to want to deal with it. You explain the various benefits and why it's necessary to do certain things. First thing he did, he gave me a machine to monitor my blood sugar level. He checked it with me. So it was that part of it I felt, wow, you feel that he's really taking your medication or taking your illness serious. And in turn, you do the same thing. So it's been a benefit to me coming to see him. Recently I saw the doctor and he prescribed medication for me. And then Mohammed rang me. He asked, we spoke about it. So I came in and we had a chat. It makes a lot of difference. They're treating you with, a great degree of respect and more empathy. And they make you understand clearly what needs to be done and the join of thinking behind everything. Make you feel, they care, You can't buy that. You really can't.